Hello everyone, and welcome back again to This Week in the Clinic. We're here with episode number 7. We've covered some powerful topics so far in the past 6 episodes, which you are welcome to check out on my Facebook page. All the videos are posted there, and these are available 24/7 after they happen, so you can go check those out. For those of you who might not know me, or if it's your first time stopping by, I'm Josh Gitalis. I'm a clinical nutritionist and functional medicine practitioner. I have a clinic here in Toronto, which I own and manage, and I also work with people all over the world through Skype and phone consults. And I run a functional nutrition certification program where we cover everything from supplements to digestion to mental health to hormones. We cover the whole gamut in there. And I basically split my time between my practice and teaching and doing these wonderful shows for you guys. So you can basically, learn and work to become your own practitioner. I'm a strong believer that we all have to take control of our own health. So that's why I'm here doing these, to help you guys. And in This Week in the Clinic, I take the lessons that I learn over the week in the clinic, and I bring that information to you so that you can learn from these pearls and apply them to your life to live a healthier, happier, wholesome life. So thank you all so much for joining once again. I really appreciate if, as I go along here, you give me a good old thumbs up or a like or a heart or something, so I know that you're following along and enjoying the information. I welcome questions as I go along here. I welcome comments. Love to get the conversation going. If you think anyone's going to benefit from our topic today, which is the dangers of hormonal contraceptives, don't hesitate to share it with them. Because when we're all healthy, we all benefit, right? So, you're only as healthy as your immediate environment in your circle. So we're going to get right into it. We've got some really cool stuff to cover today. We're going to talk about, I've got a little itinerary here. We're going to talk about how many people are at risk for side effects, how many people are actually taking these things, what are the risks of taking hormonal contraceptives, and I probably will be focusing in on the pill, right? Which is a pill you take for hormonal contraception. Usually including an estrogen and a progesterone combination, sometimes just progestins. And yes, there's other forms of hormonal contraception like the patch, IUDs when they use progesterone, and the NuvaRing. So there are others, but we're mainly going to focus on the pill, and we will be talking about at large about hormonal contraception, so they will apply to those other forms as well. We're going to talk about common side effects, how to safely discontinue these things, and most importantly, how to restore health after taking the pill. Okay? Because, so many people take these, I'll talk about those numbers in a moment, without maybe knowing some of the side effects, and I've spoken to, hundreds of women by this point who regret ever taking it, and I get asked a lot, what do I do after I stop taking the pill? How do I restore my health? And maybe sometimes I even get asked, I'm currently on the pill, how do I mitigate those effects? So we're going to cover all of that today in this episode of This Week in the Clinic. So let's get right into it. I first want to just establish how many people are actually taking these things. So does anyone out there joining me on Facebook Live have any idea what the extent of the birth control pill is? How many people are taking these things worldwide? Any guesses out there? Any thoughts? Well, the answer is 100 million people worldwide are taking the birth control pill. So it's no small matter. A lot of people are being affected, and many people are not given the full information that's associated with taking this drug, right? Most women are going to the doctor. They're saying, I want some birth control pill. These are some of the reasons why people get it. I want the birth control pill for birth control, okay? Maybe I have acne, okay? So a lot of women get it to control acne and skin issues, which is a whole other discussion because, you're treating one thing when the issue is something else. Another reason why people get it is because their cycles are all over the place. Another reason why someone gets it is because they're bleeding a lot when they menstruate. These are all various reasons why people get the birth control pill. And I like to think about the body as this wonderful factory, this wonderful mechanism that is fantastic at communicating to us what it needs and when it needs it. Now, women have the added benefit of a menstrual cycle, right? They can actually get an extra report, whereas men don't really have this report. And it tells them sort of how healthy the body is. So if the cycles are all over the place and the hormones are all over the place and there's excess bleeding and et cetera, these are all signs and symptoms that there's a deeper problem at large here. And what I'm always interested in is trying to figure out what that deficiency or excess or toxicity or whatever it is involved there, okay? Oftentimes it's just masked with these drugs. So about 100 million people are exposed to these drugs. And what's interesting is that the birth control pill is the first drug that's ever been prescribed that is not treating a specific illness. Okay, I'm going to repeat that for you. It's the first drug that was ever prescribed that wasn't treating a specific illness. Now, don't get me wrong, back in the day when they started to introduce hormonal birth control, it was a big win for women all over the world. For feminism, people were very happy. Well, women were very happy that they can now control this aspect of their life. But of course, the risks hadn't been elucidated at that point, which are now quite evident. Now, another thing is that when we prescribe a drug for whatever illness, there's usually a risk-benefit assessment that takes place, right? Whenever we introduce a foreign substance into the body, there's consequences, unless it's a natural substance like food, are usually positive consequences. But when it's a synthetic chemical, like a drug, there's always consequences. And we have to weigh the consequences with the benefits. So if I have an infection and it's taking over my body, well, I'm probably going to take an antibiotic because the benefits totally outweigh the cost. The cost is dying. The benefits is saving my life, right? So I'm going to take that antibiotic. Yeah, it's going to probably wipe out all my bacteria, maybe put a little strain on my liver depending on what it is, but it's a benefit. Now, when it comes to the birth control pill, this isn't an assessment that normally takes place. It's mostly a lifestyle type of risk benefit. So there's multiple risks, which we'll talk about, and the benefit is not getting pregnant, which obviously is very important for a lot of women. But let's dive into a little bit about some of the risks involved in the birth control pill, which when you go to your doctor and you ask for this pill or they prescribe the pill, they rarely list off these risks and make women aware of what the actual risks are. Okay? So one risk is there's an increased risk of cervical cancer when you're on the birth control pill. Actually, I'm just going to back up here for a moment and talk about breast cancer. That if you've gone on the birth control pill before the age of 20 at all, or for 5 years consecutively before the age of 35, you have a 3 times increased risk of getting breast cancer. Now, why is this the case? Why are we actually increasing risks of these cancers? Well, we're exposing our body to more hormones. What is the birth control pill? It's a hormonal contraceptive. It's adding hormones to the body, trying to fool it into thinking that there hasn't been implantation, right? So this is an extra load to the body. It's an extra load of these hormones to the body. And hormones have a specific physiological effect. Of course, in this case, it's birth control. But We also know that there's multiple cancers that are hormone dependent. They're often labeled estrogen receptor positive cancers or progesterone receptor positive related cancers. So these typically happen in the breast. They happen in the cervix for women, so it increases the risk of breast and cervical cancer. I know there's a lot of reactions happening. This is outstanding, and it's crazy that a lot of people don't know this, and that's why I'm doing it here. So if you're just joining me now, we're talking about the dangers of hormonal contraceptives, because I want women everywhere to know the risks before they make that decision. It's called an informed decision. And yes, hindsight is 20/20. A lot of women wish they knew this today, but there's a lot of ways to mitigate the effects and to restore our health. And that's what we're going to get to. So I'm not going to leave you hanging, I promise. Okay, so there's actually increased risk of heart attack with the birth control pill. There's an increased risk of yeast overgrowth. So there's a ton of information coming out on the microbiome, right? The bacteria that live within us that outnumber us about 10 to 1. And one of the things that upsets that balance is hormones, taking oral hormones, right? Who would have thought? Pretty much anything that we put down into the gut is going to affect the microbiome in some way. We just learn at different times what's affecting the microbiome. I read an article recently in Scientific American that artificial sweeteners alter the microbiome in the gut and actually cause people to retain more calories. So it kind of works against the goal for a lot of people for artificial sweeteners, right? Everything's going to affect the microbiome, and we know that birth control pill affects the gut. It can cause yeast overgrowth. It can cause yeast infections. And how sexually active do you want to be when you have a full-blown yeast infection? Not that much, right? So it kind of defeats the purpose of taking birth control. Another issue is it can mask underlying issues related to, polycystic ovarian syndrome, endometriosis, fibroids. So, typical situation, a woman has a period that maybe there's heavy bleeding, maybe it's, kind of all over the place, maybe there's very strong PMS symptoms, and one of the prescriptions that they're given is the birth control pill. What does that do? It just kind of drowns out the noise and forces and bullies the body into finding a place of balance, therefore suppressing some of those symptoms. Now, there's various contributing factors to PCOS, to fibroids, to endometriosis, like inflammation, like blood sugar dysregulation, like estrogen dominance. But if we're drowning those symptoms out, how can we ever appreciate these symptoms and work to deal with the root cause? The root cause, which isn't just going to affect, gynecological issues, it's going to affect the whole body. Low blood sugar and inflammation is going to hurt all tissues in the body, right? So it masks certain things that could be going on. Okay, we're also going to talk, when we talk about the recovery, there's nutrient depletions. So what happens when we add hormones to the body, or any chemical for that matter, is our body has to detoxify it. It has to clear it out of the system. And it does this through liver detoxification. Okay? So we've got a process, we've got our liver, it's pretty big on the right side, tapers off to the left side. There's a couple phases of detoxification. You can kind of think of like a recycling factory where you take a glass bottle, you send it to the recycling factory, they break it up into pieces, they then turn it into dust, melt it down, and then ship it out. That's basically what we do to hormones. We make them, we use them, they do their job, then we send them to the liver, and they got to be processed, detoxified, and shipped out. What do you think helps our body to do that? Nutrients, vitamins, minerals, and all sorts of nutrients. So the more of those hormones we're exposed to, the more nutrients we use up. Does that make sense? I think that should make sense. And there's a specific group of nutrients that are depleted when we take hormonal contraceptives. Why do I know this off by heart? Because I've only looked it up about 1,000 times. B2, B6, B12, folic acid, magnesium, zinc, and vitamin C. Now, interestingly enough, a few of those vitamins, like the B vitamins, B6, B12, are super critical for the health of the endometrial lining, but they're also very critical for mental health. We need to be able to make neurotransmitters, and we need these nutrients in order to be able to do that. So let's go back again. Why a lot of women go on hormonal contraceptives is so that they can be sexually active and have, you know, a carefree sex life, so to speak. But how many people are going to be wanting to be sexually active when they're depressed and anxious? They're not, and that's what these depletions do. This topic is covered quite extensively in Kelly Brogan's book, A Mind of Your Own. She goes through a whole bunch of pet peeves, and one of her pet peeves is the birth control pill because of this effect. You know, she sees a lot of patients, mostly women, dealing with depression and anxiety and things like that, and she asks them, one of their first questions is, are you on the birth control pill? And I guess one of their first steps is to get them off the birth control pill because that's been associated with lower states of mental health, right? We also cover this in great detail in my course, Mental Health and Neurology. It's actually starting in a couple weeks, February 9th, where we go through the effects of hormones. We go through how to actually address certain mental health issues. So you can check that out. The link is actually posted in the description here if you want to know more information. So we're continuing along with different risk factors. The other thing that happens to a lot of women is they begin the birth control pill early on after menarche. Menarche is the first time women get their period. The reproductive organs take a little bit of time to mature, right? First, they're maturing up until the point where a woman is able to menstruate, and then they're maturing for a number of years, 4 to 5 years afterwards. So a lot of women begin the birth control pill right after they get their first period. I see this all the time. And it doesn't really give their organs a chance to mature. So that's another risk there, that there's going to be an immature reproductive system. Another clear and present danger of the birth control pill, and this is well known by the medical community as well, is deep vein thrombosis or blood clots. So some women are more susceptible to exposure to these hormones in relation to how they affect their blood, and they can get blood clots, which can cause very, very serious issues. I've had one client over the years that I've been practicing that was actually one of these people who got a blood clot from their hormonal contraceptive and dealt with some serious, serious stuff. So that's a risk as well. And there's actually a couple studies that were published in Medical Hypothesis, one in 2014 and one in 2015, and what they found was that women who were on the birth control pill before they got pregnant actually had offspring that had higher risk of autism. Autism is a very complex disability, and there's many factors that play into it, and this is just another factor. So those are some of the risks associated with going on the hormonal contraceptives. Now, I've seen a lot of comments come in, so I just want to take a moment to kind of check in with you guys on Facebook and see what's going on here, see if I can comment on a few things. I see Kathy said, I stopped using the pill 17 years ago because of depression. Yeah, that's something we just covered. And that you're not alone. I mean, a lot of women are dealing with that. Natalie mentioned she was on the pill 17 to 29 years, haven't touched anything since. You're now 47. Well, Natalie, we're going to cover in great detail, if you stick with me here, how to really replenish the body and heal it after that type or that span of time on the pill. I see a lot of people are dealing with similar things here. Natalie's also commenting she had PCOS and endometriosis as a young woman and was put on the pill because of that. Lindsay is mentioning that Josh had to help fix me after too many years off the pill, or on the pill, I guess. I felt angry I'd taken it so long, never been fully informed of what it was doing. Would never recommend it to anyone now. Yes, I mean, you know, I don't think you're alone. I think Natalie's also mentioning I will do so much better for my daughter. Yes, you know, we learn from this, and that's why we're sharing this information. You know, there's so much to learn from each other's stories and from what we've learned in the past. So let's move on a little bit here with some of the information. And I want to say thank you, everyone, for your comments. I really appreciate them, and I think everyone tuning in also really appreciates them. So moving on to some side effects, common side effects. And again, I'm not, you know, pulling this from nowhere. You can go right on a website for any hormonal contraceptive and see the list there. So headaches and migraines, gallbladder or liver problems, including benign tumors. So, you know, these extra hormones put a strain on the liver, so it can cause gallbladder and liver problems if you're more susceptible to not being able to detoxify them. Increased blood pressure, weight gain, mood changes, we talked about that, related to depression and anxiety, nausea, cramping, irregular bleeding and spotting between periods, breast tenderness, and low libido. Remember, isn't this called the birth control pill, right? To help people have a better sex life and not really think about contraceptives. And I think the whole issue, I mean, this is a whole other topic, but that the woman has to be in charge of taking care of that is, I think, something that's ill-perceived as well. You know, the male in the relationship should also be on board with working on natural ways for birth control pill, so that the woman doesn't have all the onus on her. And I think that's something else that's actually something else I've discussed with a number of clients as well. Okay, so the last one, low libido. You know, one of the things the birth control pill does is it increases thyroid and sex hormone binding globulin. So what it does is it ties up, it increases this protein in the bloodstream, and it ties up more of those sex hormones, like testosterone, that would improve libido. Okay? So, you know, a woman goes on the birth control pill to, you know, so that they don't have to use natural forms of contraceptive. And then they get headaches and migraines, gallbladder issues, blood pressure, weight gain, mood changes, nausea, cramping, breast tenderness, and low libido. A little bit counterproductive, I would say. Okay, so this, you know, these estrogens and progesterones that are in these things can be fairly taxing on the liver. They put an extra load on the body. We also have an added effect of various endocrine disruptors in the environment. I've got a study here entitled The Endocrine Society's Second Scientific Statement on Endocrine Disrupting Chemicals, and they're listing off a few. Bisphenol A, phthalates, pesticides, persistent organic pollutants. I've spoken about toxins in past episodes. Bisphenol A is really interesting, actually, because it's used in plastics a lot. I mean, there's been a lot of move to eliminate this from products, but in the 1930s, bisphenol A was actually trialed as an estrogen replacement. Isn't that crazy? And now it's in plastics, right? And people are exposed to this all the time. So this puts an extra load on the body as well. And we're going to, again, talk about how to detoxify all of these. So a few points on discontinuation. Well, what do we do if we want to come off of it? And I've had a number of clients come to me and say, you know, I've learned about the dangers or the risks or the effects of birth control, and I want to come off of it. I want to come off of it safely, and I want to feel good when I come off of it. So there's a few things I tell them. First, that it can take 3 to 6 months for the body to kind of heal and for the cycle to come back and for regularity to come. Now, sometimes it takes people up to 1 year. The length of time that it takes for healing depends on a number of things. One is the type of contraceptive used. A couple other things is the length of time on the drug, the age of drug intervention. So say you got your first period at 13, and then you go on the birth control pill at 14, and then you come off of it at 30. Might take a little bit longer to heal because you didn't have that 4 to 5 years to allow your reproductive organs to actually develop and grow, right? If you got your first period at 13 and then you start a birth control pill at like 20, it might not take you as long to go through that healing process. Key point here is how healthy was the cycle before you went on the pill. Remember, I mentioned a lot of people go on the pill to basically deal with a cycle that's completely out of order, right? That's maybe extra heavy PMS symptoms, and they're using it as a treatment for symptoms. And also, that person's basic health and nutritional status is really important as well. So we've talked about the risks. We've talked about the side effects. We've spoken about a little bit of discontinuation. We looked at some research. Now, I don't want to leave you hanging. What do we actually do to help repair the body from being exposed to different hormonal contraceptives? And the first thing is be patient. Okay, so step number one is you want to give the body a little bit of time to heal, right? When you come off of it, things have to get back in order. Messages have to be relayed appropriately. Our endocrine organs have to, sort of come back online and realize that they're the only ones doing the work. Communication with our thyroid and pituitary has to come back, so it needs to be a little bit of time. So what else can we do? Well, I spoke about how estrogens and progesterones need to go through this detoxification process through the liver, and in that process, they can use up nutrients. So, where is my book? There's a fantastic book called Supplement Your Prescription by Dr. Hyla Cass. And what she talks about in her book are all the nutrient depletions that occur with consuming different drugs, and one of the ones she covers is oral contraceptives. And we spoke about how B2, B6, B12, folic acid, zinc, magnesium, and vitamin C are all depleted. So we want to replete those nutrients by consuming foods that are dense with those nutrients and possibly taking some supplements to replete those nutrients as well. Super important. Something to even consider is working with a functional medicine practitioner or a nutritionist, naturopath, to assess your different nutrients that may or may not be deficient through blood work, through functional lab testing, or whatever tools they have to check those things. Pretty simple to do. So we want to maybe take a nice multivitamin, eat good nutrient-dense foods, and replete those nutrients that might be low. Now, another thing I mentioned earlier is that those hormones can actually disrupt the gut flora, the bacteria in the gut. So we want to replenish and restore and heal that gut. And we can do that by consuming prebiotic and probiotic foods. So probiotic foods are, fermented foods. So kimchi, sauerkraut, properly made pickles, yogurts, coconut yogurt, or dairy yogurt, kombucha. These are all great ways to get natural probiotics in. And we also want to consume prebiotics. And what are prebiotics? Just different types of soluble fibers. So onions, apples, Jerusalem artichokes, garlic even has some, so any soluble fibers are really great for restoring that gut as well. And then if we want a little benefit on top of that, we can take probiotic supplements, for a couple months or something to really help to restore and re-inoculate that gut. Okay? And then finally, if you're coming off hormonal contraceptives, you still want to not get pregnant, there's really great natural ways to prevent pregnancy. And so a little education might be in order. And I want to give a shout out to my good friends at the Red Tent Sisters. The Red 10 Sisters, good friends and colleagues of mine, they have if you just Google the Red 10 Sisters, they have some amazing programs for educating women on natural contraception. And for those people who want to conceive, natural conception, right? The same information that helps you to not get pregnant can also help you to get pregnant. So the Red 10 Sisters are amazing. Check out their website. They have some great programs, and they're a really good couple people to get on board with if you want to learn how to do this naturally. And you can do this naturally in safe and healthy ways and not putting women, your bodies, at risk. Because the birth control pill and hormonal contraception, if we go way back to where we started this conversation, was the first drug to ever be prescribed for a non-illness. Mind-blowing stuff here. So that's what I want to cover today in this week's episode of This Week in the Clinic and the Dangers of Hormonal Contraceptives. Going to check in here, see if there's any comments or questions online, and then we'll wrap this up. So I see Maya mentioned, yes, they are amazing. I think you're referring to the Red 10 Sisters. Yes, they're really great, and I've actually had a number of my clients work with them. Question here, hi Josh, can we use this protocol after removing a hormonal IUD? Absolutely, 100%. So yes, I mentioned at the beginning I was focusing on the birth control pill because that's probably the most used, but there are also hormonal IUDs that use progesterone. There's also copper IUDs, not going to have as many of the, or not going to have the effects that we see with the hormone ones, but for a progesterone IUD, you can definitely do the exact same protocol we discussed with the nutrients and the probiotics and stuff to help restore the health of the body. Great question there. Comment from Laura, wow, I got pregnant first month after going off the pill. My son has anxiety and learning disability. Wish I was more educated then. Yeah, I know. Hindsight's 20/20, but we do the best that we can do with the information that we have in the moment that we have it. So all we can do is just try to do better. And I want to thank you for sharing that little piece of information with us. And I think that's it for the comments. So, you know, if you like what you hear, there's lots more episodes from where this came from. We're on episode number 7. You can check out my Facebook page where we have a great collection of all the episodes from the past. We talked a little bit about mental health today. We have a course coming up called Mental Health and Neurology, where we talk about depression, anxiety, insomnia, memory, what it takes to have a good nervous system and a good brain and a healthy brain for our whole life. We talk about neurodegenerative diseases, Parkinson's, Alzheimer's. We talk about ADD and ADHD, also autism. We cover a lot in the course. I also have a functional nutrition certification program. You can check at functionalnutrition.ca. Both of the links are in the description for this live cast, so you can check that out if you want. Any other information can be found on my website at joshgitalis.com. I see one last comment coming in from Rebecca. She says, great live cast, thanks for doing this one. Sharing it with a few people I know who need to hear this. By the way, hormonal contraception totally messed up my thyroid many moons ago. I was definitely not properly informed back then, as I believe most people aren't. That's the point of these episodes of This Week in the Clinic. I want to thank you all so much for joining me. As I always say, the best way to get started is to get started. Use this information, share this information with women and women you think need to be informed in your life. And I hope to see you all again very soon. Take care and have a great day. Bye.